All right. Hey, you guys. So I wanted to take some time to go over the basics of conducting evaluation and treatment via telehealth. This is going to be a pretty broad overview of these topics, but I do get asked about like how do you do telehealth? How do you evaluate somebody virtually? How do you treat them virtually? What are the options? And typically, I get these questions from people who, are a lot more like hands-on, or people who are just like super duper beginners to the area of telehealth. But I want to start off by saying that, you can do like 80, 90, 95% of what you need to do virtually. Um, at least in my experience. And definitely, like, disclaimer, when it comes to telehealth, you need to make sure that you are on board with telehealth. And then you also need to be able to assess your patient and like knowing who they are, and knowing what their functional level is like, knowing what their like mental capacity level is, and making sure that they are appropriate for telehealth. So those two pieces of the puzzle need to fit. Both you and the patient need to be appropriate for telehealth in order to make it something that is feasible, and a good method for delivery. So, let me just click here. So, what to consider with telehealth, especially because it tends to be, in most cases, like one on one care. You are direct with the patient, and you also need to be good at communicating with them what your expectations are and like what the patient should expect with this experience with you. There are a few different steps that you want to make sure are coming into play with this. So, first of all, there needs to be a good pre-frame. We'll talk about that. And then obviously doing the evaluation, the assessment, coming up with a plan of care, and then communication post-evaluation, treatment sessions, and then asking for feedback. So we're going to touch on all of these. So number one, the pre-frame. So you want to make sure that there is like a clear process for the client, for the patient coming on, like what happens if they have a problem and they want to work with you. What is the process? Because if there's confusion at that point, it's not going to be good. So there needs to be a clear process. So most clinicians that I've seen, they offer 10, 15, 20-minute free consults, either over the phone, over telehealth, or, virtually through a video conference software. Just some kind of free consult where like the client can come in and talk to you and get to know you a little bit, which is something different from like traditional like therapy rehab settings, is to be able to speak to the clinician and have a free consult first before they opt into care. So I think that's a pretty good place to start, and then you can get to know a lot of the people in your target audience and what problems they're dealing with, and that'll just make your business function better overall anyway. So typically there's a free consult. Sometimes people just want to hop right into the full evaluation and get going, but that's going to be completely up to you when it comes to having your own practice. So let's say that you do a free consult and you and the client really mesh and you want to work together and get their problem taken care of. So there needs to be a plan. They need to know what to expect next. So say you do the free consult and then you want to schedule like a full workup, a full evaluation and assessment to take a look at their movement patterns or any other functional tasks that they might be having difficulty with. So between that free consult and the evaluation, there should be something happening in between. Most of the time, telehealth practices will provide intake forms, consent forms, and possibly a client welcome pack via email or via the client portal online to the client before their first appointment. So intake forms, pretty standard. You can make your own, you can find some online. I have some in the toolkit available. Consent forms you definitely need to have. I also have the example of a consent form in the toolkit, but you want to make sure that the client is consenting to working with you virtually on telehealth. And if you do plan to record the sessions, you need to make sure that you have it 3 ways in writing that the client agrees to be recorded, and then you need to have them agree to it before and after you hit the record button. And then the client welcome pack can be really helpful, just kind of, solidifying the client's decision to work with you, and like you could include a little bit more information about yourself as a clinician, your background, but it can also be good to spell out, some like best practices for you and the client during your sessions to make them the most productive and most effective. So these are things like, hey John, like looking forward to seeing you on Thursday. Here's a little bit more about me. Can't wait to talk to you. But in the meantime, make sure that you fill out my intake form, fill out my consent form, and then when it comes time for your appointment, make sure that you are in a quiet place, that you have a good internet connection, that the lights are on, off. Clinicians have different preferences for that. Make sure you're wearing workout clothes, etc. Like things like that, things that you want the client to have ready and in place so that the appointment is effective and productive and a good time for you both. And then you can just kind of go over again, like what to expect on your first appointment. So something like, we're going to spend an hour together, and during that hour, we're going to go over, your past medical history, the problem that you have going on right now that, we touched on in our free consult. We're going to do some different physical tests to get a baseline for where you're at, and then we're going to come up with a plan of action for us to work together. So that's kind of the pre-frame and setting it up really well, and setting, expectations and boundaries will make it much more effective and much more helpful, and provide a really high quality client experience, working with you one-on-one in this private practice versus some traditional settings. And then evaluation and assessment. For me, I am a lot more hands off as a clinician. I've always been a lot more like exercise based. So when it comes to doing telehealth and working with my patient population of athletes, it wasn't that hard of a transition. However, I do know that, there are some clinicians here who might be a little bit more hands-on, more manual based, or clinicians who like to work with other patient populations. And we'll talk about that a little bit. But, like I said at the beginning, like 80-90% of what you do in person, you can also do virtually. You do need to step up your game as far as your communication goes, your leadership, and being direct and concise about what you're asking of your client. But that it just takes practice. It's just skills that you develop, and as you get more comfortable doing it, it'll get better along the way. But what is really helpful for like these online sessions, and honestly like any kind of like one-on-one session that you have with somebody, is to welcome them, see how they're doing, how their week's been, how their weekend is, how their day is, what's going on, and then jump into kind of like a pre-frame again. So spend, like 30 to 60, 90 seconds explaining to your patient again what to expect during today's session. And these are the phases we're going to move through. And by the end of the 60 minutes, this is the goal. This is what we are going to reach. So that, you and your client are on the same page. And that can also help, keep things on track so that you stick to your time frame versus, just kind of like chatting the whole time. And then before you know it, that hour has turned into 2 or 2.5 hours, which is fine if you're okay with that. But, I know a lot of you kind of want to stay on a timetable. And then, you want to launch into the subjective or the interview. At this point, you should have their intake form. Best practice is to have it filled out prior to this appointment. And, most things online, like an example of the software that I use, Intake Queue, you can fill it out on your phone. It's really, really easy. And clients really like it. Actually, I've gotten good feedback on that. But, go over the patient's past medical history, anything that concerns you, any red flags on the intake form, discuss their current problem, how it's affecting their function, and talk about, like goals that they want to reach, like function that they want to be able to have. So for me, most of my evaluation is spent in the subjective and interview phase. And we talk a lot about like symptom behavior and how it affects different movements, what movements bring on their pain, what makes it better, what makes it worse. All kinds of stuff like that, just gathering clues. And we do a lot of talking. But then you want to move into the objective. Best practice here, you might already have a hypothesis from your subjective, but now maybe we want some objective measures to give us a baseline and give us that quantitative data that we can compare and contrast with later on. So range of motion, I have heard from other clinicians that they will literally hold up a goniometer to the screen and have their patient move, and they'll measure the angle of the joint motion with a goniometer there. You could also eyeball it. You could take pictures. If you have the permission to record the session, you can always take a photo of the video. You could stop it. You could do a screen clipping, a screenshot, and you could take that photo and put it into their chart so that you would have, this is my range of motion day 1, and then you could compare it as just kind of like better, worse, or about the same, picture to picture as you go. You could do different special tests. You could come up with different ways to have the patients do it themselves, really whatever ones you like to use. I had a question the other day about doing manual muscle testing. I can't really think of a good way to do manual muscle testing via telehealth, but it's something that you could always look into and ask people about. But my suggestion was to come up with some kind of functional test, whether it's like doing the 30-second sit to stand test, the tug, or like the patient specific functional scale, I think is my favorite outcome measure because it's really specific to what the patient wants and needs. And I can always put a link to that below. Otherwise, you can just Google it, the patient specific functional scale. But say it's something like, getting up out of a chair. They ask for 3 to 5 functional tasks, and say the patient rates getting up out of a chair on a scale of 0 to 10, 10 being I can do it 100% of the time, 0 I can do it 0% of the time independently. They rate it like a 6 out of 10 today, and then when you do a reassessment in the future, maybe they rate it an 8 out of 10 now, and that is an objective measure, and there's good research behind the PSFS. So you could try to do some kind of like manual muscle testing, or you could look, more so at these functional assessments. I think that they're definitely more valuable when it comes to, the patient's values and priorities, is their ability to function. But if the patient does have like things that are weighted at home, maybe you do a test of like shoulder presses. If they have dumbbells, like 5-pound dumbbells, maybe today they can do like 10 overhead shoulder presses before there's too much pain or they get too fatigued. And then on reassessment, now they can do 20. And so you can just mark that and measure that. And then definitely safety is a concern. Like I said, I typically work with pretty low complexity patients, and everybody is, in relatively good health, and, they're with it cognitively, and they're just like not really fall risks. So my advice with safety, for one, is, like I said at the beginning, you need to make sure that this patient is appropriate. If they have like a really prevalent issue with falls, and they live alone, they might not be appropriate to do telehealth with you. If your plan is to do a lot of balance, you might want to investigate being a mobile physical therapist for them and just going to their home, so that you can be there to guard them. But, say that the patient has been screened, and maybe the patient has somebody that they live with, a caregiver or a spouse or family member that can be there to help them during their appointments. That's great. And then the other thing is, or maybe they're just like good health anyway, on the intake form I always collect the patient's name, phone number, email address, but I collect their home address And I also collect an emergency contact. So if for some reason you are working with them via telehealth and like maybe they fall, they can't get up, you can call 911 and tell them exactly what address the patient is at. You can stay on the telehealth call with them until the ambulance gets there, or whatever. And then you can also contact their emergency contact and be like, hey, this person fell. I think you really need to get over there. I called 911 because they're unresponsive or they can't get up. So then like you have that information just in case. And this is something that I think a lot of clinicians are concerned about, but I think as long as you screen the client and make sure, that the pros outweigh the cons, or like the benefits outweigh the risks. And then you collect their address and you collect an emergency contact and you have kind of like a standard protocol for if something happens, or what safety concerns your specific patient population might have. And like you already have a plan for if something happens. I think that this is, totally fine. Because another way that I look at it is like if you see somebody in the clinic and you send them home with a home exercise program and they go home and they fall while doing the exercises, they might be alone at that point and there's nothing you can do. But at least with this, if something does happen, you have so much information available, and you might be with them, on the video conference call, that you can actually help. So I don't think that there's necessarily any more of a risk doing telehealth with certain patient populations versus seeing them at a clinic and then them going home and doing stuff. But like I said, if you feel like they would be more appropriate to have somebody there to help them, then you can figure out a plan for that. Either you go or you figure out a family member to be there for their appointments. And then, based on the subjective objective, you just go over assessment. You have your hypothesis, you have your tests, what's going on with the patient, and what is your plan going to be. And so this is where things come into play as far as like what your offer is, what like programs or packages you offer, and you can gather the patient information and like plug and play into the options that you have available for sale. And then you want to make sure that you schedule the next visit on this call, on this appointment. I have had way more luck doing it this way, ending this appointment and making sure that the patient has another appointment versus doing the process of like ending their evaluation and then sending them a link to schedule. Most of the time they will not schedule the second appointment. So you want to make sure that you get them scheduled for their next visit at the end of this evaluation. Otherwise you may or may not see them again. And then post-evaluation, again, you can provide really high quality customer service by sending a follow-up email, follow-up message, whatever avenue you use to communicate with the patients. Say like, hey, John, you did a great job. It was so great to see you. A little summary maybe of what we talked about. Summary of our plan working together. Can't wait to see you on whatever date. Here's like XYZ that I might need from you, or, here's your homework until next time. I didn't include it on this PowerPoint, but, you might have a certain method of delivery when it comes to your home exercise program. I personally use TrueCoach. I think that personal training software is really helpful when it comes to delivering exercises. But you can always use like HEP to go, or like find your own exercise pictures or take your own pictures and come up with PDFs and send those. But I have had a lot of good feedback on TrueCoach because it sends the patients automated emails and they have an app with notifications. And so there's a lot higher level of compliance with the exercises, I think, using a software like that than just sending a PDF. Excuse me. And then complete your notes. So you can do like one of two things, just like any regular appointment. You could take handwritten notes while you're in your appointment, and then after the appointment, go into your documentation software and type up the note. I've also been experimenting with just pulling up the note during the visit. I know a lot of clinicians do that, and I'll just type away and type a summary while the patient and I are talking, and then like go back and proofread it after. But make sure you're completing your notes, because I have heard of and seen clinicians not writing any notes at all, which, when it comes to being a cash-based practice, there's no like insurance looking at your notes or anything like that, unless they request them if you are submitting a super bill. But best practice. And then, you do so much during the week and see so many other people. It's just good to have the notes so that you remember what you're doing with somebody, and you can just hop right back into the plan and move forward. And then treatment sessions. So these you can do one of two ways. I typically, with like my patient population, what I will do is more so like check-in appointments, and they're closer to like 30 minutes versus an hour. And we talk a lot about what they're doing. I can pull up their profile on TrueCoach and take a look, at what they've done and any comments they have. They can also submit videos of themselves doing the exercises, so we can do like a movement analysis. Otherwise, I'll like have the patient do different movements if they're having trouble with them during the check-in call, and we just go over that and see if there are any anything that we can change, any suggestions I have, and then we just go from there. But otherwise, the other way to do it, just like typical traditional setting, is that you are with the client for an entire treatment session, whether it is 20 minutes, 30 minutes, 45 minutes, 60 minutes, 90 minutes. You create the plan for them, all the things that they're going to do, whether, it's exercises, using different equipment they might have at home, self mobilization or like other self manual techniques, and you hang out with them for the entire treatment session and make sure they get everything in. So that might be more appropriate for other patient populations, like we talked about before, maybe older adults, versus like some of the CrossFit athletes that I've been working with don't necessarily need me there for the entire hour to go over, how to do like air squats and lunges with them. But we can always get into that on another PowerPoint, another presentation, talking about different patient populations. So yeah, kind of one or the other. And you would just discuss this with the patient on their evaluation, like what to expect for the visits coming up. And also ask them what they want. So, I mean, I might be assuming that, my athletes don't need me, but maybe they want me there, to like watch their lifts, watch their movements, and help them through an entire workout and an entire treatment session. So just make sure that you're checking in with the client and asking, how you can best be of service. And then what's really, really helpful is asking for feedback. So there are different ways to do this. You could always send a feedback email after every single appointment. You could send a feedback email every 30 days or every 6 weeks, or just at the end of care, or right before the end of care is usually best, to get somebody to actually fill it out. You could ask for feedback verbally and record it on a call like this, or you could make a feedback form, but asking the clients what they got out of it, that's really great, or what needs improvement, what's working, what's not, can be really, really helpful, not only for you and the client, and your relationship working together, but also your business and other, client relationships moving forward. But I would get into the habit of asking that what's working, what's not, on a pretty routine and regular basis, so that you can make changes to the plan of care as you go, instead of like waiting to the end. Yeah, and just asking what they need from you. I've worked with different clients now. Some of them, they just need like a 10-minute check-in and they're like good to go. They'll just keep doing their program on their own. Some clients need a lot more time. Some people want to talk a lot more about like different like health and wellness issues. Some people want to talk specifically like weightlifting, movement and assessment and analysis. So just be really open to that and make sure that the client knows that feedback is totally okay and good to have, because it'll just make everything better. But yeah, that is going to be it for today. Like I said, really, really broad overview, but try not to overthink it too much. It's not super different from being in person, especially if you can see and talk to the client. Really, like the only thing that you can't do, is like mobilizations and different manual techniques, at least, clinician to patient. But then there are different ways to help people do like self mobilization stuff as well. um don't get too caught in the weeds with this. You're only going to get better at it by trying. So go into it with somewhat of a plan, version one of your plan, see how it goes, see what the client thinks, and then just keep making changes to better yourself, and to better your business, better your practice as you go. So yeah, let me know what you guys think, and then I will plan to talk to you guys soon.